Well, welcome, ladies and gentlemen, to this edition of the 700 Club. We've got a shocker for you today, in case you haven't heard it. While you and I and other Americans have been forced to suffer under that thing called Obamacare, in order to get it through Congress, Congress was allowed to be exempted from some of the provisions, and the government can give them, each congressman and each staffer, $12,000 subsidy against their insurance payments, so it won't hurt them. And Congress, with all of that hypocrisy, failed to withdraw and repeal Obamacare. Why? Because it will hurt them coming out of their own pockets. We're going to tell you how it operates, how they did it, and what President Trump can do to get rid of it. It's a shocker. Wendy.
Well, the president is also working to get America's economy and businesses growing again. Dale Hurd brings us that story.
Many have wondered what would happen if American business was unleashed from the tremendous burden of government regulations. It's something President Trump wants to see, too. The president told small business owners at the White House Tuesday he's creating an environment where small business can flourish.
America is on the verge of a golden age for small business. We're ending job-killing regulation. These folks know that very well. And we're really ending at a record pace, I'll tell you. And pursuing bold tax cuts so that our companies can thrive, compete, and grow.
The president also pointed out that the stocks have been hitting record highs and unemployment has reached one of its lowest rates in 10 years. Another way Trump is pushing economic growth is tax reform. Senate Republicans will bring a bill to the table this fall using a fast-track reconciliation process, which would allow the bill to go forward without interference from Democrats. And the president is not giving up on health care, saying he wants a new plan in the Senate. Over the weekend, he tweeted a warning to Congress. Trump tweeted, "If a new health care bill is not approved quickly, bailouts for insurance companies and bailouts for members of Congress will end very soon." The president has repeatedly said Obamacare has to go one way or another.
Let Obamacare explode. It is exploding right now. You know, I said from the beginning, let Obamacare implode and then do it.
Health and Human Services Secretary Tom Price insisted Trump is just trying to move the debate in the right direction.
That's why he keeps coming back to this and saying, look, Senate, do your job. Congress, do your job.
It's not clear if Trump's threat to mess with Congress's health care is real, but it is clear that when it comes to the fight to end Obamacare, the president seems determined to win. Dale Hurd, CBN News.
Well, we've got a shocking story for you today. Behind-the-scenes deal. Obama and the Democrats saying we're going to impose this iniquitous program on the American people. But we're going to exempt you. And guess what? The Office of Personnel Management was allowed to call the House and Senate a small business. The House and Senate of the United States have been classified as a small business in order to have the employer give subsidies. With us now from Washington to talk about this special deal for Congress on Obamacare is Phil Kerpen. He's the president of American Commitment and a leading free market policy analyst. I read about this and I am appalled. I literally am appalled. What did they do and how did they make this deal behind the scenes?
It really is outrageous. When the Obamacare law was being written, one of the things the American people were very clear about was if you're designing a new healthcare system for the rest of us, you need to be willing to put yourselves in it to show that it actually is a good system, actually is quality, actually is affordable, all these other promises that you're making. And so they actually did that. In the law itself, they included something called Section 1312 D3D that terminated the previous employer coverage that members of Congress had under the Federal Employee Health Benefits Plan and required them to go into to Obamacare. It did not provide for any employer contribution. But as we were getting close to this provision taking effect in 2014, members of Congress started going crazy, saying, how could we possibly pay? This is going to cost thousands and thousands of dollars. They didn't want to vote to change the law they had passed because that would have been very damaging for them politically. So they went to President Obama and they quietly behind the scenes said, hey, can you bail us out of our own Obamacare law? And President Obama, understanding that it would have been unseemly for them to reopen the law and so forth, he said, yeah, no problem. And as you mentioned, he directed the Federal Office of Personnel Management to authorize an employer contribution for members of Congress, despite the fact there is no such contribution provided by law. But they had a practical problem, which is the regular Obamacare exchange does not legally allow and has no logistical mechanism for an employer contribution. So what they did to implement this scheme is they said, we'll have the House and Senate pretend to be small businesses, and we'll put them in the District of Columbia Small Business Exchange, and then we'll make taxpayer-funded employer contributions to cover the cost of premiums for members of Congress. And in fact, we learned through Judicial Watch's FOIA litigation that they filed just 2 forms certifying the House of Representatives as a small business with less than 50 employees, even though it has 435 members and thousands of staffers, and the U.S. Senate as a small business with less than 50 employees, even though it has 100 senators and thousands of staffers. And this scheme has continued to this day. It began in 2013. It continues to this day. You and I and all of your viewers are paying the premiums for health insurance for members of Congress, despite the fact the law said they were supposed to be in Obamacare like anyone else without employer coverage.
Phil, I'm horrified at the hypocrisy, especially the Republicans who, would not vote together to repeal this monstrosity called Obamacare. Is it because they're taking that subsidy too? And how much is the subsidy, by the way, that each guy is getting there? Is that for the members of Congress and each of their staffers? And how far does that go, that subsidy?
It's for members of Congress and for their staffers. It is 72% of the total premiums. So it varies by plan, depending on which plan they pick. And there are a lot of different choices in the Small Business Exchange in D.C., unlike most of the rest of the country in Obamacare. And so it varies, but it can be as much as about $12,000 for each individual, which is a lot of money, and it really insulates them from the cost of Obamacare. And the whole point of this provision was to make them feel the pain if it didn't work.
Well, I say, I'm a little guy out in the boondocks, and I've got these enormous premiums and these huge deductibles, which really make my insurance ineffective. And you're saying the government is going to pick up 72% of the premiums of every one of those, every staffer, every congressman, every senator, every one of them is going to get that kind of subsidy? Is that what you just said?
They are presently receiving that subsidy, and in my view, it's unlawful, and I hope President Trump does end it.
Well, why hasn't there been some outcry? Or is it just so hidden that nobody knows about it yet?
Well, I think there has been some outcry. Everyone I've talked to about it has been outraged, and it's beginning to get more attention and a little bit more coverage. But one of the challenges on an issue like this is when both parties in Washington, D.C. benefit from something, it's hard to shine a spotlight on it. You don't have those natural allies and that natural platform to raise the issue. And so it's been a bit of a challenge from that standpoint because you're right, Republicans and Democrats have been taking advantage of this.
I remember Phil Gramm talked about some group. He said the public will be hunting them down like dogs. I think the public ought to go after this in a big way. But what can Trump do about it? You say this was an executive order from Obama declaring this a small business, and he can change it. Can Trump change that?
Yeah, absolutely. This deal was done by a rulemaking at the Federal Office of Personnel Management. It can be reversed in the same way. And President Trump can and should direct the Federal Office of Personnel Management to rescind the Obama rule and to issue a new rule that makes clear that members of Congress are entitled to no so-called employer contribution and will have to pay for their own Obamacare premiums. And I think if he did that, they would have a very strong incentive to actually get a repeal and reform bill done because they wouldn't feel personal relief for their own family finances until they provide a relief for the rest of America.
Phil, I've read that there's many as, I don't know the number, 3,000 states or so, or counties that are losing their exchanges, only have one payer, and many of these insurance companies are asking for as much as 30% increase in premiums. Do you know how that affects them? What are the numbers out there in relation to the average person now?
Well, the number of counties in America that are going to have only 0 or 1 insurance company in the 2018 plan year has now grown to over 40% of all counties in America. So over 40% of the country geographically will have a 0 or 1 insurance company left in Obamacare for the 2018 plan year. And you're right about premiums. They've already on average more than doubled in the 4 years that Obamacare has been in effect. And we're looking at an average increase again of about 30% on top of them already doubling in most places. And so this thing is really breaking down. The insurance companies can't make it work, which is why they're fleeing. And for the limited insurance companies that are left, they're basically telling their regulators, look, you need to give us another huge premium increase or we're going to leave also. And so the whole thing is sort of in meltdown right now. And that's why it's so bizarre how much denial there is in Washington. They seem to think this is optional, but it's not optional. This is mandatory work that they've got to get done for the American people.
Well, in an average policy, the deductible is what's killing people, because they have to, pay up to that deductible before they can start getting insurance. So how does that work, and how much are those deductibles?
Yeah, the deductibles have also risen pretty dramatically, and so you're looking at a lot of policies now in the exchanges that have deductibles of $5,000, $6,000, $7,000 in some cases, which means even when people are paying very, very high premiums, you're right, they're not able to access those benefits. They're still out of pocket when they actually have medical needs, and there are a lot of stories out there about people who are foregoing needed medical treatment, even though they're notionally insured because they can't afford those deductibles. And this is one of the central features, I think, of the replace bill that they've got to get done, is they've got to have help for people to pay for those deductibles in the form of expanding health savings accounts so that people can put their own pre-tax money away to pay for those deductibles, as well as assistance. I believe the form that the subsidies take in a new bill should go directly into those health savings accounts, so lower income people will have that money to save for their deductibles, and they can save it across years as well. So if you have a healthy year, you can save that money and use it the next year when you might be able to need it to pay for deductibles.
Well, Phil, thank you for the work you're doing. I really appreciate it. Phil Turpin. Ladies and gentlemen, I think it's time that the American people rise up and scream to Congress. John McCain stood on the floor of the Senate and made a speech, and everybody said, this is the most wonderful speech, what he said about unity and harmony. The truth is, he voted, was the killing vote that prohibited the Senate from any kind of repeal, even the skinny bill it was called. But he ran as a senator in the election in Arizona on the ticket that he would be the one to repeal Obamacare. That was his platform. And then he gets up there and makes that speech, and everybody tears in their eyes and how wonderful it is. But it was fraudulent. I mean, the whole thing is fraudulent. And ladies and gentlemen, something's got to be done. If there was ever somebody, that movie about the man that said how mad he was, well, you get that mad. 72% of their premiums are being paid by the federal government under the fiction that the Senate and the House are small businesses. They deal with trillions of dollars, and they're small businesses under the Office of Personnel Management. Now, I recommend that you write your senator and say, listen, I am mad. And if you're going to get a 72% discount or at least subsidy on your premiums, I want it on mine too. I want the same thing for the American people that you guys in Washington and your staff are getting. And I think it's time you yell really loud. Get on the phone, and here's the number to call, and jam up the phone up there. It's 202-224-3121. And, of course, they call that the SOB. That's the Senate Office Building. 202, there it is. Ring that phone and tell those people you are mad. This is horrible. They get a 72% premium on their health insurance, and you have to pay it all. And the premiums have gone up in some states as much as 100% and more and climbing. And now they want 30% more across the board. That's what's happening. And what he said, doesn't that horrify you?
It really is a shocking story. I hadn't heard this, and it really is appalling. It's appalling.
Well, I mean, this is the real good, 72% subsidy, and they slipped it in, and Obama said, okay, buddies, we're going to take care of you. Go ahead and stick it to the American people, but we'll protect you. Who wants that kind of thing in a democracy in America? It's small wonder the people threw those people out and wanted to change. Now, let's make Congress behave themselves. Trump's got it. Take the pen, Donald, Mr. President, sir, and do it to these guys and make them behave. And once they begin, as Ronald Reagan said so well, it isn't necessary that they see the light, but that they feel the heat. Let's put some heat on them. Please, let me give you that number again. Write it down and pick up the phone and call Washington and say, I've had it. You must give up your congressional subsidies on health care. There it is. 202-224-3121. Get on the phone and call up and say, I'm mad.